This video lecture is for study session 8, and the topic of this study session is nurses' role in prevention and control of diseases in the community. The control of diseases is a central and major concern of community health stakeholders. The control of diseases initially was limited to communicable diseases. However, public health practitioners have expanded the scope of control measures to non-communicable diseases, including chronic diseases. The community health nurse, as a member of the health team, is closely involved in the dynamic process of control of diseases. This study will focus on nurses' role in the prevention and control of diseases in the community. On completion of this study session, you should be able to describe the levels of prevention of diseases. You should be able to explain control of communicable diseases and enumerate the control of non-communicable diseases. And lastly, you should be able to describe the surveillance, tracking, data collection as a strategy for prevention and control of diseases and discuss management of disease outbreak. Now, levels of prevention of diseases. Targeting levels of prevention ensures effective intervention by promoting protective factors and reducing risky behaviors. It provides foundation for planning preventive programs and education. The three levels of prevention are primary, secondary, and tertiary level of prevention. The first one is primary level of prevention. At this level, development of a disease is avoided. Most population-based health promotion activity are primary preventive measures. For example, hand washing, immunization, personal hygiene, and positive health habits. The second one is secondary level of prevention. At this level, preventive activities are aimed at early disease detection, thereby increasing opportunities for intervention to prevent progression of the diseases and emergency of the symptoms. Example of this is early treatment of diseases. The third one is tertiary level of prevention. It reduces the negative impact of an already established disease by restoring functions and reducing disease-related complications. There is also another classification known as three-tiered preventive intervention classification system. This category of classification contains the universal, the selective, and the indicated prevention. Universal prevention addresses the entire population. Selective prevention focuses on groups whose risk of developing problem is above average. Then indicated prevention involves screening processes and aims to identify individuals who exhibit early signs of diseases. Now, control of communicable diseases. Communicable diseases is an illness which is caused by a specific infectious agent or its toxic products, which arises through transmission of that agent or its products from a reservoir to a susceptible host. Such transmission can either be directly as from an infected person or indirectly through the agents of intermediate plants and animal hosts, vectors, and inanimate environments. There are three main methods of controlling communicable diseases. The first one is to eliminate reservoir of infection. The objective of this method is to find and treat all infected persons, both patients and carrier, thereby eliminating sources of infection. The second one is interrupt the pathway transmission. This mostly involves improvement of environmental sanitation, personal hygiene, and food hygiene. The third one is to protect the susceptible host. This may be achieved by active or passive immunization and chemoprophylaxis. The general method for the control of communicable diseases are preventive measures through vaccination against epidemic, control of patients' contact and environment, just like a quarantine. Then epidemic measure these are measures to limit spread of communicable diseases, e.g. mass immunization, and international measures, that is the control of international travelers in and out of the country. Now, control of non-communicable diseases. Non-communicable diseases are diseases that cannot be transmitted by infectious agents and cannot be transferred from one person to the other. Examples of non-communicable diseases are cancer, hypertension, diabetes, obesity, and so on and so forth. What is common in all these non-communicable diseases is that they are mostly chronic diseases. Methods available for prevention and control of non-communicable diseases include primary method, that is health education, periodic examination, legislation against any potential causal agents. And the second one is secondary method. This method deals with early detection of the diseases and screening tests, treatments to cure or stop progression of the diseases. And the last one is tertiary method. This method deals with rehabilitation of people that are already infected, then the nursing care of terminal or chronic diseases in hospitals or patients' homes. Surveillance, tracking, and data collection. This is a continuous scrutiny of careful observation of the distribution and spread of infections and the related factors with sufficient accuracy and completeness to provide basis for effective control. It involves systematic collection of all relevant data, orderly consolidation and evaluation of this data, prompt dissemination of the result to those who need to know, particularly those who are in position to take action. Morbidity and mortality reports, special report of field investigation of epidemics and of individual cases, isolation and identification of infectious agents by laboratories, data concerning the availability and use of vaccines, and information regarding the immunity level. Now, when there is an outbreak of diseases, there is need to manage it so that it won't get out of hand. Disease outbreak management includes 1. Provision of prompt and adequate care. It includes secondary preventive care and tertiary care, that is rehabilitation. The second one is health education activity through mass campaign to a targeted population who have high risk of contacting such diseases. The third one is it serves as part of epidemiological investigation group by helping to design and collect for epidemiological analysis. It involves in implementation of regulation for control of diseases. The fifth one is to plan, to implement, and to evaluate immunization measures. And the sixth one is to control of the spread of infection. And the last one is provision of therapeutical care in treatment centers. We have come to the end of this study. You can consult your study material to have more understanding on the subject that has been discussed in this video. Thank you for listening.